Dr. Gomez, I would like to talk to you about something which apparently is super important and is sometimes overlooked by patients. They come in, they have a bunch of missing teeth, and they don't want to, they don't fix it at all, or they fix it with a bridge, or when it's many of them, they want to fix it with a denture. In many cases, the denture is preferred than the implants, or so, simply because of price. Never mind that a denture is a denture, it's just not as you cannot bite into apples the way you can bite with implants or so. But there seems to be one phenomena which most people don't look at it, and that is once the teeth come out of a bone, the bones where they sit in it start shrinking. It's almost the bone says, "Hey, I'm useless." It's a little bit like if you put an arm in a cast because you hurt it. Well, weeks later it will be small, weak. Basically, the arm says, "I'm not needed." Same happens with the mouth, and here's what happens when that happens. Because basically, who cares? Let the bone shrink. It's in there, but it looks like. We start looking ugly, like a dried out tomato, like a little witch, and a caved in face, which no matter what will happen when you put no replacement in it, no implant I'm talking about, because a bridge does the same thing. It doesn't really replace those teeth, so the tooth in that area where the bones in the area where the tooth is missing will shrink and will, to the degree that there's many missing, give you an old look, 5, 10, 15 years older looking, and who wants that? Am I right with this, or is this not true?
Yes, you're right. Yeah, that's the problem. When you extract the teeth, the bone is going to shrink, and no matter what. So you have to prevent that from happening. And one of the options that we have now is putting bone grafting on the scapula when you do extraction. So we kind of like to explain to patients now that when we extract the teeth, we wanted to prevent the bones from shrinking that much, and we put bone graft there for the future. If the patient decide that he wanted to go and have implants placement, we're going to find bone there that is going to support the implant. If you leave it like that, the bone is going to shrink, and by the time the patient decides that he want to go for implant, he might not have enough bone there to have it, and he might have to go for a bone graft procedure that will be more invasive, will be more costly for the patient if it was done, previous when we really did extraction for the patient.
So the bones do shrink, and again, yes, then you have to do bone grafting or whatever, but most importantly, not most importantly, but what I'm pointing out now, nobody wants to look older than he is, and if your bones shrink in your face, you will start looking older. I think patients should know that. I think that's something very important. It's not just about your bone shrink and you'll have other teeth lost. I mean, that's bad that you lose other teeth, but at least
Everything is going to sink. Like if you do extraction in the front, the lip is going to go down. The face is going to look completely different because you have no support to the muscles of the face, and that's what is going to make you look older if you don't do anything about it.
We don't want that. So if a person doesn't have the money to put implants in it and needs a denture, would it be a very good thing for him to immediately start saving up for implants so that in a year or two at the latest or whatever, he can replace the denture with implant, and by doing so prevent the shrinking of his bone and prevent getting older faster than he really does?
Yeah, exactly. That's what we're trying to do. And also we advise the patients that he can start placing implants. They don't have to be placed all at once. If let's say you have a couple of teeth that are loose and you know that those teeth are going to have to be extracted, you can prepare yourself and try to put some implants there, so at least you prevent that bone from shrinking. And then later on, you can get more implants in, and finally you can have a fixed prosthesis or a denture supported by implant, that is going to look much better than one without anything.
All right. So one can work it just like with almost anything else in life. You don't necessarily buy a $50,000 wardrobe all at once, but you buy one shirt, one this, and or
right.
in a new house you decorate one room and another one, and that way. That's interesting.
If you can afford to have everything done at once, that would be the best way to go. But if you can't, then you have to find a way to do it, and you definitely have to find work. It's like when I tell the patient, when you want to have a house and you want to build a house, you have to prepare yourself. You have to make a plan, and then you decide, how big your house is going to be, and you shoot for that. You plan yourself, and you make some goals for how you're going to do it, and you save little by little. There's a lot of, now we have finance company that can finance work for the patients, which work really great, because sometimes the patient doesn't have all the money, and if they get a loan, if they can have the work done right away, and then later they can have a year or a year and a half to pay whatever loan they got, and that will give the chance to the patient to have the work done right away instead of waiting and trying to save it, because when if they trying to save, maybe something else comes in the way and they spend the money.
Right.
And that way sometimes they can have the work done without having to wait for them to save the whole amount.
Good solution. Absolutely. A good solution. Good. Well, thanks, Dr. Gomez. Sorry.
You're very welcome.
Thanks, Dr. Gomez, for informing us. The moral of the story is try not to lose your teeth. If you do lose them, go and replace them with implants, simply because otherwise your bone will shrink, and when your bone shrink, you start looking ugly. I got it. Thanks.